Hello and welcome to Conversations with Dr. Westman. Today's topic is, do you really need that medication? We also have a bonus for you. It's Dr. Westman's free 8 ways to kill sugar cravings, and we'll put a link for you in the description. How are you doing, Eric?
Doing great. How are you going?
Very, very good. Thank you. And thanks for joining us again. Eric, when you went to medical school, you were taught about different medications, and what you would need to treat your patients. Did they ever teach you how to treat patients using lifestyle as opposed to medications?
Well, you have to realize I went to medical school a few years ago, actually decades, but I've been at Duke University in a medical school pretty much ever since. Or after training, I went to Duke and then stayed here as a professor. So I followed what medical schools do. And then, we got a lot of training in how the body works and how the body can go wrong, in terms of heart disease and things like that. We had pharmacology sorts of classes where we were taught how different drugs work, the pharmacology being the science of drugs and how they work. And, in clinical practice, the training I received as internal medicine, and even today, family medicine, general practitioners, we really get just trained about medication care, not, giving medicines. Here's how you use this medicine, here's the guideline for this medicine. No, so I have to say, no, I really wasn't taught lifestyle treatment within the training and apprenticeship that we do, residencies and fellowships. It's as if the medical educational process, the system, really focuses on medication care. So when you talk about medical care, it's medications. Well, of course, surgery is different, but in terms of the treatment of chronic medical problems like diabetes, heart disease, lung disease, arthritis, heartburn, GI problems, irritable bowel syndrome, fatty liver, the doctors are just taught to use medications. And I was that way too, but I went out to get special training to learn something new.
Now, I've heard what I'm about to ask you or state. I've heard a few times at various conferences, and I get shocked every time I hear it, and I still can't believe it. But I was very, very shocked to learn that during a medical student's entire medical degree, they may have had only one single lecture on nutrition lasting no more than an hour. And so, knowing what you know now, can you actually believe that this is the case?
Well, it's shocking. And when you think about, let's say running a car, we're very careful about the fuel we put in our car, right? We go to a gas station and they've created these fuels that are very clean and pure. I mean, yeah, we get to choose different things. But can you imagine that a doctor hasn't been taught anything about what's put in the body? It is shocking that nutrition, what we eat and drink, is probably the most important thing that has to do with human health, or any animal for that matter. So, when someone goes to a veterinarian, the veterinarian says, well, what are you feeding the animal? And I'm lucky if a patient tells me that another doctor has asked them about what they're eating or drinking or exercise. Or if you put all of lifestyle into one bucket, we're talking about things that you can do that aren't medications. It's nutrition, activity and exercise, stress management, talking, these sorts of things. So yeah, it's a sad state on medical schools, including DO schools. And, they would kind of say, well, we teach something, but it's not nearly enough then. I mean, and then in comparison, if you were on par, you'd say, well, at least you get enough time in medical education to teach about lifestyle changes and nutrition as you would about drugs. If you had sort of an equal emphasis, but there's nowhere near that. And yeah, it's pretty harsh and sad. But now that I've learned more about it, talking to lots of academics, professors, the medical profession sort of divested itself of nutrition training back in the 1980s. It used to be that a doctor, a medical student in the US would learn about nutrition. And now, in fact, one of my students on my rotation recently knew more about the environmental issues about food than he knew about nutrition and food in the human body. And so we actually were sort of discussing, it's actually okay to eat meat. And he, oh no, because of all of the propaganda basically about the non-meat eaters put out there. So the medical students are learning, like doctors, like the general public, about nutrition from companies that want you to eat their products, and about other sort of promoters of certain ways of eating that really aren't based in science and health, which I thought should be what a medical school should teach, is what's based on science and health. And yeah, I'd like to see nutrition come back into medical education for sure.
So something that is extremely powerful, and I've heard you again, had the privilege of hearing you speak about this very, very often, is that when you see somebody in your clinic, if they follow the diet correctly and to the letter, you actually de-prescribe medication that very, very first day, which is, it just shows you, just that statement alone shows you how powerful food actually is as medicine.
Yeah, well, I think it was Hippocrates that said, food is thy medicine. Ancient doctors, knew this. I mean, it's all they had basically, but the idea that we would not even mention it in a clinical encounter with someone is just shocking. Yeah, I have to take diabetes medicine away on the first day to avoid low blood sugars if they're on lots of diabetes medicine. But yes, I can take people off 12 medicines over time when I'm treating the diabetes, the high blood pressure, all those things. But I want to talk about this at an even earlier stage. If you're on one medicine, think about that. If you're on one medicine, maybe you could actually get off that one, because you could do a lifestyle change that would mean you don't need that medicine. And the most common one or two that are prescribed and make the most money for drug companies are the anti-cholesterol medicines and the anti-heartburn medicines. And those are medicines I take away from people because they change their lifestyle. So my dream one day, and I teach doctors all the time at meetings, is that a doctor would give you a choice. Here, we'll give you an effective lifestyle change. And of course, we choose the keto lifestyle because it's an easy one to teach and follow. Or you can take a medication, it's up to you. And most doctors don't give you that choice. It's, well, you hear your cholesterol's high, take this medicine, or, oh, you have heartburn, no problem, we'll give you this medicine. In fact, one of the heartburn medicines now is in trouble because years later it was found that it might cause cancer. So, any drug that you take has consequences that we don't know about. And I learned that from a professor of pharmacology who said, show me a drug where they say it's very specific, it only does one thing, and I'll show you a drug that we haven't studied much, because most of these drugs have effects in other parts of the body than the place that we're using it for, like the proton pump inhibitors for heartburn. There are proton pumps all over the body, other places than just the stomach. So, and then the cholesterol medicine, most people don't know that you can lower cholesterol by changing the lifestyle. And the defense that the organizations and doctors will take is that, yes, it's in the guideline to help someone change the lifestyle, but my patients never do it. So there's a defeatist attitude so if you have a doctor who's telling you, here's this medicine, ask is there a possibility that a lifestyle change might do this, have the same effect? And if they say no, then they don't understand. They're not giving you that choice, and but realize they've only been taught about the medications. So I can't really fault the doctor down the street who has never been taught this. But now the beauty, the wonder of the internet is that you can learn from all sorts of different doctors and all sorts of different ways to go about things. And so if you've been told that you need a heartburn medicine, a cholesterol medicine, and certainly a diabetes medicine. That's kind of my bread and butter, fixing diabetes, reversing it, and taking people off medicine. But we can actually prevent the occurrence of diabetes, which is huge. And most doctors don't understand that. They don't give you the choice. And of course, you want effective lifestyle change. And fortunately, a keto lifestyle is an effective one and safe, and has been studied now for over 20 years.
So you obviously see a lot of people in your clinic. What is the most common medications that you are able to de-prescribe over periods of time? Some medications, as you said, you can start lowering or de-prescribing on the first day. Give us a little insight into medicines that you de-prescribe for different conditions.
Yeah, so I think of it in a couple of ways. One is a symptomatic treatment that might get better overnight is the heartburn. So I'll take away or tell people, well, if you wake up in the morning, you don't have heartburn, try without the pill for a day. Of course, they're not eating carbs. I've instituted a lifestyle change for them. And then as quick as 3 days, we have this in a publication years ago, as quick as 3 days, the heartburn is gone, even in people who have had refractory heartburn on medications, and they still had heartburn. So that's the huge now, but medically that's not so serious. Nobody's going to be dying of heartburn, but to the individual, that's a big deal. You don't want to be taking a pill for heartburn and having suffering from it. Here's the other kind of dilemma we're in: is many of these medicines are so strong and effective that you no longer have the symptom. And so many of my patients don't realize that while they're taking the heartburn medicine and doing the keto diet, that they don't need the medicine anymore. So I'll have to say, well, why don't you try without the medicine? And then they find they don't have the heartburn. Similarly, with more serious medical issues, the medicines have become so strong, the symptoms go away, and yet you still may suffer the long-term consequences of taking the medicine to manage the disease. And there's an alternate way, and that's just changing the lifestyle. The other kind of first day I need to do something about this medicine is diabetes medicine, the injectable insulins and other injectable medicines. If I don't adjust the medicine on the first day, someone might get a low blood sugar, a hypoglycemic event, and that's not good. It's actually dangerous. So that's where I am cautious and tell people, if you're on insulin or other diabetes medicine, don't do this without medical supervision, because this is very powerful. And it's a good thing and a bad thing, because if you're not aware that the medicine can become too strong, you might get a low blood sugar reaction. The third group of medicines is the high blood pressure medicines. This is the little sleeper that even medical doctors don't understand, that lifestyle is what causes the hypertension, and they wouldn't see that lifestyle fixes it because they don't use effective lifestyle changes. And there are so many people on hypertension medicines, high blood pressure medicines. And the interesting thing now here is that the drugs have been made so inexpensive that it's not a costly thing for the medical system to treat all these people with high blood pressure with medicines. So you get into that conundrum of it, it's too bad insulin and pills are so cheap, because then there's no motivation for someone to actually try something different. But I glow in the positive effects people feel when I take away the medicines that have side effects. And so when someone has nausea or diarrhea from a medicine and I take away the medicine, they no longer have the nausea and the diarrhea, and they feel so much better. So it really, I guess the proof is in the people I've followed for months to years. They come back to me, they're following the healthier lifestyle. They're not on medicine anymore. It's not common to need medication if you're following a healthy lifestyle. And I wish that doctors would at least take a nod to, why don't you look into this or that? If they don't understand how to do it themselves, at least refer to someone who does, or God forbid, refer to a diet book. we have a new book out, End Your Carb Confusion, which has helped a lot of people. And there are ways to get this information that does not require a doctor's prescription. and it does not require, rocket science level reading. There are a lot of great books that will teach you a healthy lifestyle, and then you won't need those medications.
So you've, besides seeing people in your clinic, which you've been doing now for the last, 15 years now, you also have a presentation that we routinely play on our lists on YouTube and Facebook, and it's called the Two Pathways presentation. It's where you show how patients can choose either path, the medication path or the lifestyle path. How successful is the lifestyle path?
Well, depending on the disease and how many you have, eventually it's almost 100% effective, so that you're basically having the consequence of a lifestyle that's not matched to your metabolism, and that's why the medicines are being used. So it may take time, and of course it may take some education about what foods to have, great tasty things, and and I'm, I guess, an unusual doctor because I talk about food. I talk about, are you satisfied with the foods you're eating, and have you found recipes? And because food really is more powerful than medication, and I want to try to hit and catch people before they're even on medicine. That's where the huge potential is, because you don't even have to start going down that pathway. And once you're on medicines like insulin and diabetes medicines, it basically traps you into a lifetime of diabetes, which is why doctors say, well, I don't think you're going to get better. People I see are always going to have diabetes because they're not changing to a healthy lifestyle. That's the reason. It's not that you have to have those problems. You don't have to be on those medications. And so I guess to answer your question, it's almost 100%, but people have to actually do it. It's the difficulty might be to match what you loved in food in the past, find substitutions that you're happy with, or introduce you to a new type of eating that actually is tasty and healthy as well.
So before we go, Eric, what parting advice do you have for folks that are listening or watching this video?
What you eat and drink really matters. I know that sounds kind of trite or duh, but no. I wish the dean of the medical school would get up on day one in front of all of these medical students who are going to be doctors helping you with your health, and the dean should say, what you eat and drink matters, and what you need to learn is how what you tell someone to eat and drink as a doctor affects them, and that then the education flows from there. Because we just don't get any of it. Of course, okay, that might be the pendulum swinging all the way over, but just consider for a minute what you are eating and drinking, and where it came from. Is it highly processed? Is it addictive? Can you stop eating it actually, or does it tug you to not be able to stop eating? Those are all the signs. And would you put dirty gas in your junk gas in your car? No, absolutely not. So yeah, what you eat and drink is probably the most important lesson you can teach your children for their health as well. If you're someone who doesn't care so much about yourself, you want to please everyone else, then you learn about this and introduce it for the health of your family. And doctors, I think, are not the resource to ask about this, with some exceptions. They're going to be the ones to ask for the medications to treat these things. And that's just the way things are today.
Eric, I think this has been extremely helpful, this video. Thank you so much, as always. For you folks that are watching, don't forget to get your bonus. It's Dr. Westman's free 8 ways to kill sugar cravings. And as I said, we'll put a link for you in the description. We've got some great courses coming up. If you would like to learn more about Adapt Your Life Academy, you can visit us on www.adaptyourlifeacademy.com. And if you'd like to see future videos, or the history of a lot of these videos. We've got about, I think, 500 videos now. You can find us on our YouTube, Facebook, Instagram, and Twitter accounts under the name of Adapt Your Life. So, folks, that's all from us, from Dr. Westman and myself for today. Eric, thank you so much for your time as always, and we look forward to catching up with you again in another week.
Thank you, Glenn.
Thanks, Eric. Bye.
If you like this video, you're going to love our Adapt Your Life Academy. So click on the link in the description to find out more.